It can be alarming to hear news reports about the coronavirus spreading, cities shutting down, and experts telling us to stay home and limit contact with others. This may be challenging for everyone, more so for people with cancer. Hello friends, welcome to my channel. I am Cancer Advisor. Today I am going to talk about how people with cancer can avoid getting infected with coronavirus. The Centers for Disease Control and Prevention says that the risk of becoming seriously ill from COVID-19 is low for most people. However, it's very important to know that vulnerable people are at a higher risk of severe illness if they get COVID-19. The reported studies stated that patients with cancer are one among the highly vulnerable groups to COVID-19, with the mortality rate of 11 to 28%, which is 3 times higher than the general population. Individuals affected by cancer are more susceptible to infections, due to weak immune system resulting from overall poor health status and immunosuppressive states, caused by both cancer and anti-cancer treatments. Individuals impacted by a cancer diagnosis should consider 2 different strategies to reduce their risk of corona infection. The first is to ensure they take appropriate precautions to avoid unnecessary exposure to the virus. The second is to consider whether changes to their treatment strategy could be implemented to reduce their risk of infection. Experts recommend that everyone should follow common precautions to prevent transmission of the new coronavirus. They include washing hands with soap and water thoroughly and often, for at least 20 seconds, stay at home, clean the surfaces, avoid close contact with people who have a cough or other respiratory symptoms, avoid touching your eyes, nose, and mouth. If you are ill, use a mask if you are going to public places. Cough or sneeze into a tissue or your elbow, avoid close contact with others, and self-isolate yourself. If you think you may have exposed to the coronavirus, contact a healthcare provider promptly if you develop a fever, cough, or difficulty breathing. Before you go to a hospital, call ahead, so the staff can take appropriate precautions. Wear a face mask to stop the virus transmission to others. People with cancer may benefit from extra precautions, like carrying hand sanitizer in pocket, wherever they go, and use it frequently in public places. Practicing the social distancing all the time is of a paramount importance. Avoid the crowds and public transport. If you're having friends or family over, ask them if they have any symptoms. Have a hand gel dispenser at your front door, and make sure everybody uses it. Stay in communication with your cancer team, and keep up to date on new developments. Let them know if you have questions or concerns, especially if you have new symptoms or were recently exposed to someone who is ill. The best thing is not to panic, and to focus on ways to protect yourself, because those small things can be enough to provide an extra layer of protection. Be positive and stay safe. Let's fight COVID-19 together. Thank you for watching.